Dr. Sreedhar Potarazu, President and CEO at Vital Spring Technologies. He's not only an MD, he's also an MBA. So he's looked at both the medical and the business side of this. What have you noticed so far?
The President made two fundamental mistakes this morning, which causes me concern. Number one is that they went into it in terms of whether the premiums were actually going to go up or down with this bill. The fact that he didn't agree or understand why premiums were going to go up is a concern. Kept intertwining the messages of care and coverage. They're very different messages. And
why?
Because it's not enough to just provide the right coverage. It's not enough to check the box and say you've got an insurance policy. What's more important is that you and I as individuals have the right coverage for a lifetime, not just give you, a check and hope that that takes care of everything. And the third big mistake was he used his car insurance experience as an example. Wrong answer, because car insurance is based on risk, on your driving record and all of that. And health care coverage should as well. And that's been part of the challenge. There's a clear lack of understanding in terms of how this whole system really works.
Let's go back to premiums, Dr. Potarazu, because this is an issue that not just Senator Harkin of Illinois brought up, but we know in the past couple of days, Kathleen Sebelius, Health and Human Services Secretary, using WellPoint as an example where they hiked premiums 39%. You say that employers who have these people covering them, that the onus is on them right now to be tougher on insurers. How should they behave when, say, for example, a United Healthcare or a Humana comes before them and says, sorry, guys, we're hiking you by 14% for all of your employees? What do employers do?
Great question, Liz. They need to be much more accountable in terms of how they're managing these insurance carriers. And I've been at this, God knows for how long, in telling them that they've got to take the bull by the horns. Because here, the WellPoints and the Uniteds are really not the insurers. They're only administering the plan, as opposed to a car insurance company or a life insurance company that is taking on the financial risk. The ones really taking on the financial risk are the employers. So it's essentially giving the insurance companies an ATM card or a debit card and saying, go spend my money. I don't really care how much you spend.
So what should they say? I'm going to leave you for somebody else. What if that somebody else is another company that's also hiking rates?
And that's very important for the employers to stay independent of that. You know what the State of the Union today is for many companies is they buy the services from Anthem or from United and then go back and ask them, so how are you doing? Who goes to a used car salesman today and says, so what car should I buy? We don't do that as consumers, yet that's been the State of the Union, is to sort of disintermediate themselves in terms of the service and how they evaluate them. And I've been a big proponent of this sort of vendor independence so they can drive competition.
All right, well, we've been hearing a lot of figures thrown back and forth by both sides. People tend to be cavalier in these situations of throwing out figures to prove points. Of course, sometimes you can use figures to prove just about anything if you're a clever enough economist. But Dr. Sreedhar Potarazu has been listening along with us. And one figure the president threw out, Doctor, which was that the cost of the uninsured for the folks who are insured is $1,000 per person. That would total up to $100 billion of cost for the uninsured. Now, the most recent study I've seen by Kaiser, 2008, shows that the cost for the uninsured is about $28 billion. That's off by a factor of 4.
Well, this is the magic math, right, David? Because that's exactly right. Based on what the president just said, there's no way that we're expending that many dollars right now in terms of covering for the uninsured. And it comes back to, I think, a bigger question is in terms of the basis of the estimates and how the CBO is supporting some of the things that the president is talking about. Very spurious.
What's the best way to calculate the true cost, Doctor?
The true cost of every dollar we spend in health care when we consume it takes up the dollars we spend when we go to the doctor, how much we spend on our prescription drugs. What also factors in is if you and I can't be at work, that's about 60 cents on every dollar that's incurred within the system. When the CBO goes out to score how much something is going to cost, they're only looking at a very high level in terms of some of the medical costs using these life tables, but not looking at actual numbers of what an individual is going to cost the system. And because we're talking about such huge numbers, plus or minus a small percentage can translate into, a major difference. And that's part of what we're hearing Vice President Biden talk about here is, bending the cost curve is important, but we got to have the right baseline.